Good afternoon, everyone. This is Kelly Smallridge, President and CEO of the Business Development Board, and I thank all of you for attending today's 8th Town Hall meeting. If you are attending for the first time, this is a virtual gathering of Palm Beach County's business, government, and education leaders. Every Friday, we meet to receive updates from those leading us to the other side of this pandemic. Today's call is pretty timely. If you have channel 20 turned on right now, you'll see that our governor is conducting a press conference right here in Palm Beach County. In addition, our county commission met on Tuesday to discuss steps toward phase 1 reopening. And they met again today. They are still meeting to discuss the opening of our beaches on May 18th. So we have a lot of information to present, and we're hoping that as our first two speakers go, that our county administrator is able to join us. So we're going to have to shift accordingly. At this time, I'll turn it over to our moderator, Corey Saban. Corey has over a decade in the television industry. He's a crisis, media, and public speaking coach and the president of Video Bolt. Corey, thank you so much for leading our discussion today, and I'll turn it over to you.
Thank you, Kelly, and good afternoon, everyone, and welcome to all the callers joining the line. I'm Corey Saban, president of VideoBolt.com, and today's moderator. As Kelly mentioned, it's a live telephone town hall meeting from the Business Development Board of Palm Beach County. It's also being broadcast live on ESPN West Palm 106.3. And we're in the process of bringing on hundreds of people onto the telephone line to participate in this live event with government and business leaders from all over the county. I'd like to ask everyone to please mute your phones so we're not interrupted with any background noise. If during the call you have any questions, please chat our BDB host by hovering over the bottom of your screen and clicking the chat box on your taskbar. Well, our first guest is someone we all know very well. I'd like to welcome Congresswoman Lois Frankel. Prior to her election to Congress, Lois served as mayor of West Palm, raising the city to a new vitality and earning a reputation as an innovative problem solver. Lois, we're excited to hear updates from what's happening from the halls of Congress on coronavirus. Welcome to the Zoom.
Well, thanks. Great to be with you, all of you, and thank you, Kelly and BDB, for your leadership in this county. And I know that you all are all about bringing business to this county, and obviously the pandemic has really thrown a wrench into that mission. So I want to cover a couple things with you today. First, I want to talk a little bit about a reaction to the governor's order. The governor just stated, I was watching on TV, that Palm Beach County will be allowed to go to phase 1, and the reopening of the potential reopening of the beaches. And then I want to cover with you some of the major programs that we put into place in bipartisan legislative packages. And then I want to just give you an idea of where we're going, hopefully in the next couple of weeks, in terms of Congress. So I think it's very important. I want to start. Listen, I love the name of this was getting back to business. And we all want to get back to business. There's no question about that. I do want to tell you about a letter that was sent by many of us in the congressional delegation to the governor. We sent it today, and it's really relative to our last legislative package, which we put in $25 billion in funding for testing. And as a condition of the state getting that, they're going to have to have a testing strategy. And I'll just read you a part of the letter. It says, testing is the only way to gain and maintain an accurate understanding of the prevalence of the virus. We need a comprehensive testing strategy to reopen safely. And so what does that mean? It's not just testing in a massive way, which we need to do, but it is contact tracing and then isolating people who are sick. And if they don't have the means to isolate themselves, it means having supportive quarantine situations, which we do have here. And I really do think the county commission has done a good job. The but I want to tell you about another meeting that I had this week with healthcare professionals and first responders. And these were nurses who were in emergency rooms and ICUs, who worked in the field, police, fire chiefs. And here's what they told me. They are literally scared to death because they don't have the protective equipment they need all day to stay safe. The gowns and the masks, they're being forced to reuse them and use them for periods of time that they feel are unsafe, and they feel like they are not only endangering themselves, but their families when they go home. Now, not only that, what was pretty shocking to me was the nurses, all who worked in hospitals, not one of them had been tested for coronavirus, nor did they say there was any widespread testing of their colleagues they were working with. So what does that mean? Maybe they don't have symptoms, but that does not mean they're not infected and that they could not endanger their families. So that's just a small example of a hard truth, which is there's not enough testing, contact tracing, and isolation going on in this country. And there's a very good reason for that, because the demand is there, but the supply is not. The supply for the necessary equipment, the personal protection equipment, and the testing has just not happened. Now, I'm not going to get into politics here. There's a difference in opinion how that should be done. The White House believes it should be left to the private sector and then to the governors to get all this these goods. Some of us, I have a respectful difference of opinion, which is that I think the president should use his authority to force the manufacturer and to coordinate disseminating the tests and the equipment, because people are back home. For example, the fire department, they're paying ridiculous prices for masks because there's so much competition just amongst the different entities. So why am I making a big deal about this to start off? And I know you want to hear about some business programs. I have spent hours and hours in hearing testimony from the top healthcare experts in this country, and it has been unanimous that we have to be very, very cautious as we try to reopen parts of our society, and that an important piece of that is having a testing strategy in place and the means to affect it, so that we know where the infection is and how we can stop the spread. So I'll get off of that soapbox and just let me talk to you about some of the things that we did in Congress in regards to trying to help people who are out of work. And the numbers are heartbreaking. Last week I went to a food distribution site. The lines were miles long. I mean, I couldn't believe my eyes to see how many people are hurting. It's really, unfortunately, the Florida unemployment system took a very long time to get working. And I think it's doing much better now, but it's still, there's thousands of people who are unemployed who are still haven't even gotten any compensation. So it's been, it could be 4 to 6 weeks that a lot of these people have gone without any money. And it's really, it's a terrible, terrible thing how many people are suffering. And I know how many businesses are having to close or are on the brink of ruin. So what we did immediately in a bipartisan basis, we had some money go back immediately to people's bank accounts. It was at $1,200 for if you were making up to $75,000. It was increments, but many, probably 90, 100 million people have gotten that. People who did not give the IRS their bank information, they will be waiting for checks for quite a while. We did boost in unemployment. Florida, it's very embarrassing, but Florida had one of the stingiest unemployment benefits in the country. $275 maximum you can get, which is one of the lowest absolutely lowest rates in the country, and only 12 weeks of unemployment, one of the, again, shortest. I mean, most states had at least had at least 24. So I point this out is because we sort of started with a handicap here in Florida. And without getting into the politics of it, I know the one governor's blaming another governor, but the fact of the matter is they are what they are, very, very stingy. Fortunately, the Congress did boost their unemployment benefits. I'm not going to go into all the different categories, but if you're out of work, you're a regular employee, you're out of work, or even if you're an independent now, if you're an independent contractor, a self-employed, a gig worker, all those people are now eligible not only for some form of Florida unemployment, but the $600 a day from the federal government for at least 16 weeks. And we also moved the goalposts. We have the amount of time that you can get the unemployment has been extended. The other, there is another avenue that apparently most employers, I don't know whether anybody listening to this knows about it, but we have found it hard to find somebody. But just to let you know, Florida, it's a state federal program called the Short-Time Compensation Program, which allows businesses who sign an agreement with the state, you can reduce the hours of your employees, and then the employees can take advantage of not only a partial of the state employment benefits, but the federal $600 a week. So I urge any of you who want to reduce your employee hours, that you find out how to get into the short-time compensation program. I think I don't know, the login is called Connect, but I can't, we can get you that exact login information, but that's an option that some of you may want to take up. Now, the other thing we did, which we've heard a lot of talk about, is the payroll protection program and the economic injury disaster loan, which are the two sort of primary new ways to get money now from for small businesses. I don't know whether you want me to go, you have to let me know whether you want me to go into the details of the PPP, but basically it's for businesses under 500 people with there's some exceptions to that. And you get to get a certain percentage of your payroll tax, 250% times your payroll tax for certain payroll for a certain period of time is what your loan is. And if you use it for payroll, for utilities and so forth, it becomes a free loan. That is, you may have some questions on that, but that's just the gist of it. The economic injury disaster loan, you can get up to $2 million. That's also a short-term loan. And up to the first $1,000 per employee is actually free. There's no interest. It's a free loan.
Congresswoman, one of the things that you hit on that I think is very timely, beside the coronavirus updates, naturally, is unemployment. The headline, worse since the Great Depression, 14% or more. What are you and the congressional delegate talking about to try to curb that problem and get people working? I know it's premature right now, but what can we do? And what type of, if you will, works program could there be in the works?
Okay, so let me tell you what our next, what we're talking about for our next package. Number one, to get money back to the state and local governments. Their budgets are going into a hole because they're not getting the sales tax, the gas tax, they're not going to get probably all the property tax that they expect. And think about the state and local governments. That's your teachers, your firefighters, the police, the people who pick up your garbage. I mean, so many people who are doing not only doing quality life activities, but these are people who are being employed and being paid. So as the state and local governments budgets shrink, if they're not allowed to borrow money for their operating expenses. So what will happen is not only will you see probably a pretty dramatic reduction in services and quality of life, but we'll be adding many more people to the unemployment roll. So that does, it's like two really bad things to happen. So we are talking, I know that the House will present a package that will include literally billions of dollars to go back to the state and local governments. We're also looking to give some more flexibility on the payroll protection program. I know, especially here in South Florida, where so much of our industry is related to tourism, it's the restaurants and so forth. The 8-week period that is now sort of the period that you get to use your money, and then you get it becomes a free loan, is difficult for lots of businesses. So we're looking at a much more flexible time period and maybe even use of those funds. And then I think as important or more important is we are looking in the House to try to get more money into people's pockets. The numbers today, as you said, are horrendous. I think it was 14% unemployment. It's going to go higher, and people have to live. I mean, people have to buy food and pay their bills, their rent, and so forth. So we are looking to try to find ways to get more money into people's pockets. I don't know whether it will be an extension of the unemployment or more direct payments like we did with the first tranche, but we are absolutely looking at that. But I want to just, Corey, going back to your question, and I've heard this is not really just my opinion. This is what I've heard over and over from people who are very, very smart, who know the health issues as well as the business issues. And that is, the way you're going to get back to business is the first important thing is to keep us healthy and safe, because it's not going to do any good to rush to reopen and then have people getting sick again and then putting a crush on our healthcare system. That would be a terrible thing.
So then to that point, you're faced with a quandary, your life or your livelihood in a sense. Knowing that, as you mentioned, phase 1 is on Monday, vulnerable groups will still be asked to work from home, but businesses will go into phase 1, and knowing from what you shared that there may not be enough supplies, what can you and what are you and your peers doing for this potential second round that we could face in the fall as things start to taper off in the summer?
Thank you for that question. No, I feel like what the Congress has done is we've literally put billions of dollars into the healthcare system. The money is there for people for us to buy these goods. What we don't have is a supply. And there is a difference of opinion on how we're going to get to that supply. We just don't have the supply. There's folks like myself who would like to see more aggressive action by the White House to force the manufacture of the tests, to force the manufacture of the PPEs, and to be in charge of making sure it's distributed. There's another side. Again, it's a difference of opinion, and the White House opinion is to leave it to the private sector and to the governors to fend for themselves. So, it's two different points of view. I can, in terms of what the Congress can do, we cannot force the president to act, to use his authority. What we can do and what we have done in a bipartisan way is to make sure that the funding is there to buy these products. Now, let me just say, I was just on this morning, was on a marine industry Zoom talking about what's happening to the marine industry. And Senator Wicker was on there, Republican from in the Senate. And we both agreed on very strongly on the point that there has to be more widespread testing in this country. And that is the way we're going to be able to start to feel safe about getting back, is when, and it doesn't mean everyone's running for a test every day, but for example, people who work in the hospitals, people who work in nursing homes, people who work in the grocery store, people who are coming in, even people in businesses who are coming in regular contact with everyday people. There needs to be a way for them to have easy, quick tests. The sad part of this situation is it's not really there yet. We are not there yet to be able to even do that. So that's why, you know, I've talked to many doctors here locally, and they have said, be cautious. The way to beat this thing, the way to get back to business is to make sure that we are staying as safe as possible.
I appreciate all of your time, Congresswoman. Thank you so much. Thank you so much. We appreciate everything you do for us, and keep up the good work.
Okay, thank you. Just let me know, Kelly or whoever, am I supposed to stay around for questions, or am
No,
I?
that's it. You're free to go. Have a wonderful weekend.
It's good to be with. Just let everybody know that we're available. I'm like most of you. I've been working from home, but our office is open. If you have any comments or questions, so please feel free to call my office. We are working literally around the clock, and everybody please be safe.
Thank you so much. From the national level, let's now narrow in our focus to the local level, and let's talk to County Commissioner Melissa McKinley. Melissa, what can you tell us in regards to the news conference that you just heard from the governor?
First, let me know, can you hear me?
We hear you terrifically.
Okay, good. Thank you. I've got to go back in. We're only on recess till 2:30.
Okay, so what can you tell us?
Sure. So the governor just held a press conference over at the ballpark of the Palm Beaches. He has accepted our request to reopen under phase 1 restrictions that will take effect on Monday. And so what that means is a very small, limited amount of businesses may reopen, primarily restaurant and small retail. They can only open at 25% capacity. So it's a very small incremental move meant to try to do what we can to help alleviate the record high unemployment rate that was just announced in our county at 14.7%. You know, I will tell you that for the most part, my colleagues didn't like that we had to do this. But local government, unfortunately, is being faced with a situation where a lot of these families were promised that if they just stayed home and helped us flatten the curve, that there would be resources in their pockets to help make up for the income that they lost. And a lot of those resources have either dried up or been extremely difficult to access. And we were at a point where you know, moms are having a hard time feeding their kids. They can't pay rent. They can't pay utilities. And I certainly appreciate all of the generosity that our partners like Florida Power and Light and our County Water Utilities Department are doing. But those bills are not going away. They're just piling up. And so we felt it was imperative to try to balance the risk on both sides of this issue. You know, the risk to vulnerable patients, you know, vulnerable populations, and the risk to families who've got nothing left in their savings account. And so that's why we supported making this request. And I'm reluctantly relieved that the governor supported it. The other thing that happened, Corey, and appreciate you guys letting me jump on for Verdenia.
Sure.
Know that she's trying to get back to the office. The other thing that happened is the board today made a decision to also, on a very small step, reopen our beaches effective Monday, May 18th. We will be receiving a presentation next Friday, the 15th, on exactly how that will roll out. We made a couple of considerations in that. We are going to make that opening for Palm Beach County residents only on the beaches. And we have decided to not open some of the concessions, the beach rentals, the chair rentals, and that sort of thing, to try to keep the population on the beaches down. Look, my primary focus in reopening those beaches was to give somebody an opportunity to go for a walk or go for a swim, not to congregate and do a drum circle on Sunday night on the beach. People have been cooped up. This is a small step, but we can take it away as quickly as we can give it. So,
Melissa, can I jump in real quick with a question? Just phase one, if you could elaborate a little bit further. I know you said restaurants can open in retail 25% capacity. What other types of businesses? People would like to know if they can go back to their gym or their church as well.
the gyms, the governor has control right now of all spas and salons and gym services and that sort of thing. He has not authorized the reopening of any of those businesses. As far as churches are concerned, they were never closed. There have been those of us in the community that have made strong pleas to our religious community, saying, please live stream your services. Please do a drive-up service. Please do not fill your congregations and your temples with large populations. Most of those religious services, they have followed those rules, but they were never restricted.
And outdoor seating?
There is no limit on outdoor seating at restaurants. The 25% capacity relates to the indoor seating.
Okay, well, I know you're crunched for time. Thank you so much for joining us.
You're welcome. I'd just like to tell everybody that none of this is easy. Knowing what we're trying to balance is a heartbreaking exercise every single day. We appreciate your patience, and we hope that everybody can follow the guidelines. Thanks, Corey. Thanks, Kelly.
You got it. So just a quick recap, as Melissa had just mentioned, phase one on Monday, restaurants, small retail open at 25% capacity, public and private beaches tentatively open on Monday, well, definitely open, on Monday, May 18th. That's going to happen as well. So let's move on from politics to science now. And we're joined by Michael Farzan. He is the co-chair of the Scripps Research Department, of Immunology and Microbiology, based right here in Jupiter, Florida. He's the co-discoverer of the cellular receptor for the first SARS virus, and that work led to the first vivacious vaccine for the SARS virus in animal models and is the basis for current human trials against the new coronavirus and for COVID-19 vaccine candidate that the duo just developed. Michael, welcome so much. And if you could give us an update on your work.
Sure. Thanks so much, Kurt. First of all, I have to mention, first of all, that I was co-discovered with my wife, who's also faculty here at Scripps Research. So her name is Hedy and Che, so don't want to forget that. But my goal here is to sort of walk down and update you on the various efforts that we're doing, mostly here in Florida, but also in collaboration with our colleagues in California, and then of course with everybody around the world. And we typically divide this into 5 categories. And it's going to be a little bit whirlwind on each category, but the categories that we typically talk about are efforts with convalescent serum, then our efforts with drugs, then our efforts with something that we call biologics, which is basically injectable proteins like antibodies, then our efforts with vaccines, and then if there's enough time to talk about some of the more recent work on that is basically discoveries on fundamental biology that are helping us understand the virus better. So and if you looked at that order, that's also the order with which things will probably be rolled out around the world. So first we'll be using convalescent sera, then drugs, then biologics, then vaccines, and of course then for a long time we'll be analyzing this virus. And I wanted to linger just for a second on convalescent serum because it's really unique among these categories, and it's a place where people in Palm Beach County can help people in Palm Beach County. So what this is first of all, what's going on in our hospitals now, which is people who have recovered from the virus are donating their blood to people who are very sick from the virus. And the antibodies in their blood, we certainly hope, and in many cases think they're working, are protecting those people, are helping those people get out of the ICU and ultimately out of the hospital. And so Scripps has been very involved in this effort at a scientific level. And our primary collaborators, I should mention, are some great MDs at the Boca Regional Hospital. And what they've been doing is, as they perform these, sort of, I kind of think of as heroic exercises, they also provide us the sort of leftover blood, for us to analyze. And so the kind of analysis that we are doing here is to understand which of the various blood samples that are provided to us best predict, what are the properties of these blood samples that best predict whether they're going to help a patient. And so that's a very interesting and I think important effort that Scripps is involved in. And in fact, I'd even sort of put it out in a sort of an advertising to say, if any of you are working with other hospitals in the area, to encourage them to work with us, and we can provide some insight into what blood will be most useful in these patients. And in any case, to acknowledge the awesome work going on in these hospitals. Drugs is, so I'm sort of moving on to drugs. Drugs is really where Scripps is extremely good. We are known for combining biology and chemistry, and that's of course at that interface is the development of small molecules. And we've been running through our libraries like crazy and coming up with now panels of hundreds of hits that our biologists are now working through to tell the world, I think, which of these are going to be most effective by characterizing them in their biology. The other kind of therapy, but also prophylaxis, are antibodies. And Scripps, and especially our California campus of Scripps, is very well known for identifying antibodies that are very good against viruses and other pathogens. And we have a parallel effort here, and we're working closely with the California groups. And our effort is also building on my wife and I's discovery of ACE2. So there's a competitor molecule that turns the receptor that we discovered into an antibody. And that has some key advantages over the kind of antibodies that other people are developing, as well as companies like Regeneron and Vir. And then vaccines, my group, and with a huge amount of help on this campus and on the California campus, is trying to describe what protein is the best target for a vaccine. So just very briefly, if you divide the world into, how you deliver a protein, and then what protein do you deliver? What part of the virus do you deliver? We're focusing our efforts on what part of the virus you deliver. And hopefully that will feed back to all the various groups that have various platform technologies so that they can use that information to make their vaccines better and better. And there will be necessarily a second round of improvements to vaccines to make sure that they can protect our most vulnerable people. And then there's some really great work going on in fundamental biology on this campus, and I'll highlight a couple of that. Well, actually, the main effort I'd like to highlight is the work characterizing the consequences of the newly emerging mutations to the virus. So you're probably all aware that around the world we've got now tens of thousands of sequences of this virus. They're all very similar, but some key differences are starting to emerge. And the key question for us is, what are the consequences of those changes? Does it make it more transmissible? Does it make it harder for a vaccine to work against it or an antibody to work against it? And so there's some just beautiful work going on this campus. There are highlight a couple of the people who were involved in that. It would be Tina Izzard, Hedy and Che again, some great people coming from my own lab, and then some beautiful, our structural biology course are all involved in trying to understand how changing the virus will change how we need to respond to the virus. And so that's kind of what I have to say, except to be sort of alert to the fact that that the work going on here on this campus, I think people in Palm Beach County can be extremely proud of. It's really at the level of any other place in the country.
Mike, thank you for that update. You know, as we know, hundreds of companies, about 100 companies are working on a potential vaccine, everyone from Pfizer, Moderna, all of these projects happening in real time and in motion. Can you share about a potential collaboration, much like in the internet space, there's open source? What can you tell us on what's happening in the science space and the communication between the individuals?
Right. So the academics are in intense and transparent communication with one another at a level that I've never seen in my life. And so the companies are also communicating. They're also scientists. They like to talk like the rest of us. But of course, they also are sometimes less transparent. But it doesn't matter because there's so many people putting ideas out there. And the most important people, unfortunately, for this are the people with manufacturing capabilities. And so I think the rest of us just feel our job is to get as much good information out to the people who can manufacture and essentially let the rest of the chips fall where they may. So Moderna will be beneficiary of everybody's investment in NIH, as will Johnson & Johnson, as will all the major manufacturing companies. And I think the rest of us who may be not, you know, we don't have stock to go up, will be very pleased to see some of our ideas feed into that process.
And give us, if you could, a glimpse into this, knowing that all of these companies are working, there's technology, a great deal of technology, great deal of science going into it. We need this vaccine yesterday. If you could put on your prognostication hat, when can you tell us that you think an available vaccine will be ready? If you had to ballpark it, and no one's going to hold you to it. Right.
Nobody's going to hold me to that. Thank you. And let me start by saying, I think on the order of 5 or 6 months, we're going to start rolling out a passive form of prophylaxis, which is to infuse healthcare workers with antibodies. That'll protect them for a couple of months, but then those antibodies go away. It's not like a vaccine. But that will be sort of the first layer of protection, and that will help. You know, Lois was talking about all the people who don't feel protected, don't feel safe right now, and that will help them in addition to PPE. The second layer will be the first, phase 1 of vaccines, and phase 1 of vaccines are probably going to be reasonably useful to people who are healthy. Meaning that these vaccines will probably protect them or mitigate the severity of their disease. But we know that these first level of vaccines, for a variety of reasons, and simply because everything you try for the first time is not going to be optimal, that they are not going to be effective enough. And where that will be a big problem will be in the people who are most vulnerable to this virus in the first place. So as you know, those of us who are old enough to worry about this virus in a very serious way will really want to keep the quality of the vaccine going forward. And then there will be a phase 2 probably of that vaccine. So the phase 1 might be as early as 8 months. And it may be helpful, especially for those of us who make a good response. And it may even be helpful if you can boost it multiple times to people who don't make that great a response. But there will be other layers of vaccines coming, and those will roll out step by step by step, and everybody will have their announcement, and we'll have to see how it sorts out.
And knowing that the FDA usually wants to make sure, obviously, they get it right, do you speculate, if you would, that this will be fast-tracked and maybe things will be a little bit looser than they typically are for some other drugs that they're working on that are in the marketplace?
Well, I hope so. I was thinking that, there is always a risk associated with vaccines. But there's certainly right now, just a risk just going to the supermarket. So those need to be balanced against one another. So I hope that will be the case. And I think we can also look to other countries with different kinds of regulatory laws, also trying things and us learning and benefiting from those as well. So it's going to be a very, I think, a rapid but complicated and sort of muddied rollout of a bunch of stuff. And we're going to have to sort through it as we've been sorting through drugs, for example.
Well, keep up the fantastic work, you and your wife, and we wish you the best. Thank you so much for joining us today. So, Dr. Farzan, thank you for joining us. Congresswoman Lois Frankel, and of course, Melissa McKinley, Palm Beach County Commissioner, and thank you all for taking the time preparing for this call so that we could benefit from your insights, experience, and information. And of course, thank you to ESPN West Palm 106.3 FM for airing this call to their listeners. We greatly appreciate your support. We encourage the business community to tap into these resources on www.bizhelppbc.com, where you'll be updating information around recovery efforts. We have another call scheduled for next week, and we'll be sending details early next week. Stay safe and healthy. Remember, we go into phase 1 on Monday. Thank you for your time today. This call is now concluded.